In harmony with our family, in harmony with our community, in harmony with our world, we should all be aging with harmony. Join Erica Sell for thoughts, trends, and tips in the world of aging and senior living. Here's your host, Erica Sell.
And I'm Wade Taylor, co hosting this premiere episode of Living with Harmony. And we now have our premiere guest. So exciting times, right, Erica?
Absolutely. I'm super excited.
Alrighty, so our guest today for this portion of the show is going to be Dr. Joseph Casciani, PhD. He's a licensed psychologist and he specializes in seniors, mindset, and longevity. So take it away, Erica.
All right. Good afternoon, Dr. Casciani. How are you?
Hello, Erica. I'm fine. Thank you. Congratulations on your podcast. This is your inaugural podcast episode, so kudos to you. That's great.
Absolutely. Thank you. And you are no novice at podcast or sharing information. I see that you have authored 2 books and have a ton of information to share on the topic of aging and mindset, longevity. So that being said, everybody is talking about living longer, seeking longevity. How do we have longevity? So I'm wondering, how is aging influenced by mindset and attitude, some things you speak a lot about in your books?
Oh, sure. Yeah, that's so important. Just a quick background. I've worked with older adults my whole career, mostly in nursing homes, and really helping people adapt to a lot of loss and change and setbacks. And some of them are temporary, like a hip fracture, and others are more long-term, needing permanent placement. So I've had an opportunity to interact with a lot of older adults and understand their thinking about getting old and their mindset, and whether it's a positive or negative mindset. So, the whole aging process does come with losses. It comes with change. It comes with the normal changes like, decline in our vision and hearing and sensory functions. And it also comes with changes that are not normal, like cognitive decline or, serious medical disorders. So it's so important. To me, the key is the mindset and how we interpret these events that take place. To me, successful aging means that we are really going to face these hurdles, these obstacles, these setbacks, and continue to move on. Because the way we interpret or label these events really says a lot about how we cope with them, how we manage them. If we see it's just an endless onslaught of losses, physical losses, psychosocial losses, and it just wears us down, then we're going to not age successfully. But if we see it as something, okay, here's another hit, I can get up, but I can get back into the ring and keep fighting, then we're going to age successfully. So a lot of it is that view that we have about how strong, how capable we are, how well we can cope with these setbacks. I always would tell patients, the road ahead is not smooth and, well paved. There's always going to be bumps. There's always going to be potholes and detours and hurdles, and we just got to face these things and move on.
Yeah, I see that. I see vastly different outcomes for people with similar circumstances. People who have had a stroke or who have had more of an acute situation happen for them, and people adapting wonderfully and kind of getting back to life, and then other ones who never do. How do you address that with someone when you kind of sense the issue, but they might not be open to the mindset conversation, or they don't see it, it's their blind spot? Do you have any training around that, or ways to, as a caregiver, maybe encourage them to have a positive mindset?
Mm-hmm. Well, I think there are a couple of ways to do this. First of all, there's the basic underlying principle that we all have this capacity to get up off the mat and keep moving forward. And it is our attitude and mindset. And sometimes people just say, look, I've had it, they throw their hands up and they say, I'm done. I can't do this anymore. And I would always say, look, there's always that fire. There's always that spark inside. It might be flickering, it might be wavering, but it's always there. And I would always talk about digging deep. We hear that expression all the time. We got to dig deep and we got to find that. But it is there, that strength, that grit, that determination, that resilience, whatever we want to call it, it's always there. So we want to help people get in touch with it. And sometimes it's locked away, sometimes it's been bottled up. But there's always that inner determination that can help us keep moving forward. And I think that's the difference. Some people that have given up just say, look, I don't have that fire anymore. It's gone. That fire went out long ago. And yet there are other people who are just the opposite. They recognize that, and they know they can, dig deep. It sounds trite, but they dig deep and they find a way to move forward.
Yeah.
Yeah.
Do you think that being able to do that can actually help them recover their strengths they may have lost, or help them better focus on the strengths left and build them stronger than before when they're able to find that spark?
I do. I would always talk to patients about being in charge. They're in the driver's seat. You mentioned that in your earlier segment here, but they are in the driver's seat. I would sometimes tell patients they're the captain of their ship. And I remember this one individual who was in a nursing home because she had a terrible stroke, and she could not move her legs. She couldn't stand up. She couldn't walk. And she was getting, into rehab, physical therapy, and eventually, she was getting more strength. And I would say, hey, Captain, how you doing? How's the ship coming along? And one day she said, well, the ship ran aground. I said, what happened? She said, I was trying to walk with my therapist, and I fell. So, I used to think that, mind and body had to be seen as a single unit, that we couldn't separate mind from body. But over time, I really learned that there is a difference, and there is a separation, because we are not our bodies. And I always tell people, we are not our bodies. The bodies may cooperate, they may not cooperate, but there's always the me in there that's in charge. There's always the me that has that attitude. There's always the me that has that fight and determination. So you want to help people get in touch with that me, that I in there, because that's who the captain is. That's who the driver is. And then they learn, all right, the body doesn't cooperate all the time, but there's still that person that has that fight.
Well, in addition to getting in touch with the me, let's really quick, with 3 minutes left, give them how to get in touch with the you. If somebody wants to follow up with everything that Dr. Casciani's doing, his website is LivingTo100.Club. Now, that's a .club, not a .com. So again, Living, TO100 as a number, .club. Will bring you into Dr. Casciani's world and all that he has to share there. So a couple of minutes left, Erica. Please continue.
Well, on that note about still being them if the body doesn't cooperate, one thing, I had a client who brings a story to mind about finding the new them in a device or technology. I have so many patients who have the mindset barrier to not use adaptive equipment. But then those, when they do and they realize there's so much left that they can accomplish with it, it just opens up new worlds to them being their old them. They can go to the coffee shop. I had one client, he hadn't been in 5 years. He got a power chair. He went to the coffee shop and they still remembered his name, and he was in tears. And it's just, accepting that life goes on and life is still beautiful, but maybe with a different modality or way to handle it every day.
Yeah, and that's tough. I agree. That's tough, because that means changing our identity. Well, now I'm no longer independent. I am dependent on another device or some type of assistance or aid, and that's changing our identity. But it's almost like let's keep looking for those strengths that are still there. We still have that desire to be social. We still have that desire to visit old friendships, and let's see what do we need to get us there. What kind of assistance do we need to get us there? So it's like the whole world isn't different. The whole world, is changing, and we have to adapt. But the more we can accept that dependence when we need it, just like going in for assisted living or some other help, when we need it, it's better to accept it and make the best of that and create a new world than it is to, hunker down and say, I don't need anything, because that's not going to work. Yeah.
That's such a great message. I think a lot of people need to hear that, maybe from an authoritative figure like yourself, someone in the medical field who cares, versus maybe their adult child or their spouse. They might have resistant to that conversation with different people.
Yeah.
I think that's really awesome.
Well, this has been. Well, I've got to interrupt. We're coming up to the end, but this has been a great conversation, and we're going to continue it in our next segment, speaking more about mindset of seniors as they age, as well as that larger environment around them. Erica will be back with more here on Aging with Harmony, powered by WSRadio.com.